Hey everyone, it's welcome to Growment. In this video, we will look at certain important points from the surgery which are asked in the Fmge in the past years. So I have tried to cover most of the important points and questions in this because as you all know that the surgery is a very vast subject and approximately 40 to 42 questions are asked in the Fmge. The format of the questions is certain one-liners, then the clinical case and image based. So I have tried to cover the maximum points in this video. Those who have already finished reading the surgery at least once, they will understand it and it will help them for the preparation. And the format of the question may not be same in the PYQs because I've tried to make the question short and focus on the question which is asked. Try to focus on the main concept. Okay, so let's see certain important points. The first question is treatment of the thyroglossal cyst, and the answer is the cyst trunk operation. One-liners can also be asked giving a direct question, or they'll be describing you the features of the thyroglossal cyst, like a young male and a mass in the thyroid, like in the neck, which moves on deglutination. Okay, so by that you need to make the diagnosis as the thyroglossal cyst, and if the management is asked, then you need to mark it as the cyst trunk operation. The next question, gas used in laparoscopy to create the pneumoperitoneum. This question was asked recently in the July 2023. Okay, and the answer is the CO2, carbon dioxide. Then the location of the ICD insertion. Where do we insert the ICD? And the answer is the upper border of the lower rib. Can be asked in integrated with the anatomy also. Then the next question, fluid of choice in intraoperative blood loss. And the answer is the normal saline. So the format of the question may not be the same or the language of the question. They may give a 2-3 lines suggesting that a trauma patient or a patient is undergoing surgery and then he underwent blood loss. Then how do we manage the patient, or what is the next step in the management of the patient? So based on the options and the question asked, you need to select the option. Okay. Then moving on, layer absent in the esophagus. It is the serosa layer which is absent. Okay, so it was asked as a one-liner, a direct question. Then moving on to the extradural hemorrhage, the EDH, a very important topic. Brain hemorrhage is a very important topic. One question from the brain hemorrhage is a must. Questions may be asked giving the CT scan and images and ask you to make the diagnosis or on the management. Okay, so let's look at the answer. Craniotomy with evacuation of the hematoma. And on the CT scan, you can see then for the management of the EDS, we do craniotomy with evacuation of the hematoma. Then moving on to the next question, the investigation of choice for the varicose vein, it is the duplex imaging, duplex scan. The next question, most important risk factor for acute mastitis, and it is cracks in the nipple. Then a persistence of the pharyngeal cleft 2 causes bronchial cyst. Next question, our best method of hair removal before the surgery. It is the hair clipping inside the OT. Earlier shaving was done, but now as the shaving may increase the risk of the infection, so the best method is to clip the hairs inside the OT table. So the best method now is hair clipping inside the operation theatre. Then the best artery for the CABG, and it is the internal mammary artery. In treatment of the Raynaud phenomenon can be asked as a one-liner or a clinical case and asked in relation with the medicine. So they'll be giving a history that a female washing clothes in the cold water comes to the OPD with complaining of her finger nails, comes with the complaint of her fingers changing the color. Okay, so how you will manage this patient or the treatment, and it is the calcium channel blocker. A very famous question, the Raynaud phenomenon. Questions are asked on the treatment or the diagnosis, or describing the clinical features and ask you to make the diagnosis. Then the next question, management of the breast abscess. Breast also a very important topic, and breast abscess questions have been asked repeatedly on this topic. So how do you manage the patient? We will do incision and drainage. Can be asked directly as a one-liner or giving a clinical case at a pregnant female in the lactational period comes with complaints of pus from the breast. So you need to make the diagnosis as the breast abscess and the management, incision and drainage. Then moving on to the best investigation for the GERD, and it is the 24-hour pH monitoring. Then next question, air under the diaphragm is seen in, also a very important topic, air under the diaphragm. X-ray can also be given, and you need to find out that there is under the diaphragm there will be blackening suggestive of the air, and it is seen due to hollow viscous perforation. So whenever there is bowel perforation or in the peptic ulcer disease perforation, you can find air under the diaphragm. Then the next question, grading used for the CA prostate. This question was asked as a one-liner in the June 2022 exam, and the answer is the Gleason's grading. Management of the tension pneumothorax. Tension pneumothorax also a very important topic. Frequently questions are asked on this tension pneumothorax, and questions are asked on the management itself. So you need to remember this. For the management, we will be doing needle thoracocentesis. Also, questions are asked, image-based questions are asked in this topic. Like, they'll be giving you the chest X-ray, and on the lung, you need to find out for the hyperlucent lung showing more blackening, suggestive of air filled in the lung. The next question, layers included in the split or the partial skin grafting. The answer is the epidermis and the superficial dermis. This question also asked very multiple times, skin grafting, and questions are also asked on the types of the grafting, the allo, the auto. So you need to look for the definition of these also. Then the next question, gold standard investigation for the varicose vein. It is the endothermal ablation. And the next question, radioactive iodine used to treat prostate cancer. So in the treatment of the prostate cancer, we will use the radioactive iodine 125, labeled 125, asked as a one-liner in the June 2022. Then the next question, complication of total gastrectomy or the ileal resection. So this question can be asked as a one-liner, and if they give one-liner, then it will be very easy to find out. But if given as a clinical case, describing the things in the question, like a female had developed cancer, a female because of cancer she had to undergo total gastrectomy, or she had to undergo ileal resection because of a tumor. Now presents to the OPD with complaints of anemia. So what might be the complication, or what might be the cause for the development of the anemia? So you need to look for the concept what the examiner is asking, because the language of the question can be changed in multiple ways. Okay, so in this patient there will be vitamin B12 deficiency. If given as a one-liner, then very easy, but if given as a clinical case, also by looking at this piece of cake like the total gastrectomy and the ileal resection, you will be easily able to mark the correct answer, that is the vitamin B12 deficiency. So again, I'm repeating, guys, the language of the question may vary. They may ask the same question as a one-liner, or as image-based, or as a multiple choice, or they can ask you as a clinical case. So you need to look for the concept of what the examiner is trying to ask, and look for the options, and then choose correct option regarding that question. So moving on, let's see the next question. The most common kidney stone, and it is the calcium oxalate. Then investigation of choice for fistula in anus, it is the MRI. Then the next question, a management of a patient with gallstone but asymptomatic. There's no symptoms, but on the USG you can see the gallstones present. So in this patient, you need to do reassurance and follow-up. As the person is asymptomatic, we will not do anything, will not treat the patient. But if the patient comes to the OPD with symptoms, then we need to do cholecystectomy. Then the next question, the most common complication of the gallbladder removal or the cholecystectomy, it is the steatorrhea. Can be asked as a one-liner, simple direct one-liner, or clinical case can be given that a lady, she had underwent cholecystectomy but now presents to the OPD with a complication. What can be the most common complication of the cholecystectomy? So the idea of the clinical case is just to make the question long and the lengthy. So if you read the question properly and read the last line, what the examiner is trying to ask, then you will be very easily able to solve the question. So this was a video of the certain high-end points related to the surgery. I hope you find this video useful for your revisions. Like the video if you find it useful, subscribe it with your friends, and subscribe to Crewmate. And also all the best for your exam, guys. Thank you. Bye-bye.